everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESTR accredited exercise physiologist. I am very excited to have a guest on with me today, the wonderful Janine Porter-Steele. Thank you very much for coming on. Janine is a breast care nurse and we are going to focus on hot flushes today, and I think this is going to be a very popular video. Hot flushes are a very frustrating side effect of some of the treatments that are known through breast cancer. So first of all, we'll let Janine introduce herself. So thank you very much for coming on, Janine. Just tell us a little bit about your background and how you came to be in this role.
Look, thanks Jen for inviting me. It is really great to be here and yes, to talk about this tricky topic of hot flushes. So my background essentially is cancer care nursing, and I've always worked in women's health, was a midwife in the past, but got the goodness knows how, but I kind of fell into this cancer care role and did a breast care nurses course. And I've got really interested in those aspects of women's health that often aren't discussed, and that's the taboo subjects, menopause and sexuality. So that's a particular interest for me. So that's kind of a bit about my background. I'm also very actively involved in research around women's wellness and women's health.
Fantastic. I think we need more Janines on the planet, to be honest. So
probably not.
Janine might disagree with that. So what we really wanted to hone in on today is firstly, what are hot flushes? And then also, what are the things that might trigger a hot flush? And then thirdly, what are some of the things you can do to dampen the effect of the hot flush, or not necessarily eliminate it, but at least try to reduce it as a side effect, because they can be pretty rough on the people that are copping them. What does cause hot flushes?
Well, hot flushes, generally speaking, people complain about hot flushes as they approach menopause. So menopause simply means when your periods stop, but most of us would go, oh brilliant, thank goodness for that. But alongside that often come a raft of symptoms, hot flushes being the one that we most often talk about. So what happens is your estrogen and progesterone start falling, and you have this little thing in the back of your brain. You think of it like a thermostat, and the thermostat goes wonky. So what happens is you start feeling this intense heat, and then you'll cool down rapidly. So it's the falling estrogen that does that. Frustratingly, for women treated with breast cancer, they may have early menopause. So imagine being 25 or 30 and going through these sorts of symptoms. It can be really annoying. And the thing about hot flushes is some people will say, oh, I don't know what you're talking about. I just go a little pink, have a little warm glow, and then it goes away again. Other people will tell you that they get super hot, they sweat, they feel really uncomfortable. Sometimes they find it hard to breathe and feel panicky and anxious. Sometimes people feel dizzy, and sometimes people can have, 10 or more hot flushes an hour. That's probably an extreme, but regardless, wherever you sit with that, if you've got a hot flush that's making you feel anxious or feel worried, or I guess feel embarrassed, because if you're sitting at a meeting and suddenly you're going bright red and sweating, people tend to look at you a bit. So it's a really tricky thing for women to deal with. It's something that we don't talk about often, and not always the thing that comes up in the context of treatment, other than to say you might get hot flushes. So essentially, hot flushes mean different things to different people.
That's it's interesting, isn't it? Because there is quite a big range there in what women experience. I've even had women tell me they can, particularly if they're having quite a high frequency of hot flushes, that it can make them quite tired. I'm guessing because it's, there's a lot of fluid that's perspiring out of them as well.
Well, it's that, but also it's the hot flushes at night. So I think sometimes we forget and think hot flushes occur in the day, but a lot of women will complain of night sweats, and their partners will complain alongside them, especially when their duvet's on and then the duvet's off, and then the air conditioning's on and the air conditioning's off. And at night, sometimes what happens is people get really hot, And then as they cool off, the sweat sort of starts to cool them, they can get freezing cold. So it's a really uncomfortable experience, and it will wake you up. And if you're waking up, you then tend to think, well, I might as well go to the loo while I'm up, or have a drink of water or a cup of tea, and then you're really awake. So people often, when they're getting bad hot flushes, complain of sleep deprivation too, which is really tricky.
And we know, of course, that sleep deprivation is almost rite of passage when you have breast cancer or go through menopause. And Janine and I were talking before we started this video about how sleep is, such a common problem for people going through breast cancer. And so we're definitely going to look to focus more on, improving people's education around how to get a better night's sleep through this channel. So watch this space, because that's a topic I think so many people are interested in. And sleep really dictates so much of your daily function, and hot flushes are just one of those things creating a broken sleep. So what can trigger a hot flush?
Well, all sorts of things. So I think if you know your triggers, you can often do something about it. And I guess, having painted a bit of a gloomy picture to start with, there are lots of resources there that will be helpful. And triggers, knowing what they are one of those resources really. And there are things you can do about hot flushes. So one of the triggers, I guess, is, as I've said, is menopause. But if you're going through breast cancer and you are estrogen receptor positive, meaning that your breast cancer is fed by estrogen, then we're likely to give you hormonal therapy, or really anti-hormone therapy. So therapies that block any estrogen in your body. So that they are often the cause of hot flushes, but you need them. They're really important medications, so it's managing around that. So if we think about all the other things that might trigger hot flushes, so for example, I'll start with this one so we can actually get it over with, the alcohol. So sometimes women who like to have a glass of wine at night, particularly red wine, that can trigger hot flushes. I know when I was much younger and drank red wine, I'd get this red flushing up my neck, and I always knew it was the red wine that did it. But alcohol in general can trigger hot flushes. So reducing your alcohol intake for a start can make a big difference. Caffeine's the same. As a lover of coffee, 1 cup of coffee a day is probably enough. That caffeine can sort of dry you out really, but it can also trigger hot flushes. Things like wearing wool and tight clothes, they can often be a trigger for hot flushes. Being in a smoky room, there's a big thing now about not smoking. We don't see so many people smoking themselves, but if you're in a smoky atmosphere or a smoky room, that can trigger a hot flush. Obvious things like feeling stressed. I mentioned the meetings before. Having experienced this myself, you go to a meeting and think, I've really got to get this right and what I've got to say. Goodness knows why, but trigger a hot flush, it does. So you can't always avoid stressful situations, but what you can do is learn to manage a stressful situation. So those that tend to be the triggers. Think about what clothes you're wearing. That's probably a big thing that I often think about, that synthetics, particularly as we're doing a 35-degree day today. If you wear synthetics, often the material can make you feel hotter than you want to, and that can trigger a hot flush. So dressing in layers, using clothes that are more cotton-based, linen-based, bamboo-based can be really, really helpful. Same thing at night. It sounds really weird, but if you use bamboo sheets or cotton sheets, only when you wash the cotton sheets, make sure you don't iron them. You'll get hot flushes just from doing the ironing, and it'll take you all day to do them as well.
Did you hear that, ladies?
Yeah,
throw your irons out.
Actually, come to think of it, I think ironing and any housework should be banned while you're going through this, just to
At least if we're going to knock out caffeine and alcohol, then you can throw your iron out as well.
Yeah, so avoiding your triggers. So drinking plenty of water. Most of us don't drink enough water. So replacing your caffeine, as I say, no more than 3 caffeine drinks a day. Avoid sugary drinks and make sure you drink plenty of cool water. Carry a water bottle with you. That can make a difference. The other trick with your water bottle is if at night you put your water bottle in the freezer, just be careful you don't use sparkling water and have it explode as you open it. But if it's in the freezer and you wrap a little towel around it, when you are at work, as it defrosts, it's nice and cool to drink. But also if you feel a hot flush, they tend to sort of, for some people they come from the toes upwards, but most of us would feel them from our neck upwards. That can cool you down really quickly. So having a bottle of water is more than just for drinking your bottle of water. This little towel that I've got in my hand here, feel that, Jen?
Very cold.
Yeah.
One of my favourite products.
This is called a chilly towel, and you can order them online. You can actually buy these from sports shops and pharmacies as well. Maybe not this particular brand, but essentially this is really, really cold. You run it under cold water, you squeeze it out. This will stay cold all night. So if you've just got this in a bowl or on a plate by your bed, if you do get hot, so you don't completely wake up, you can just learn to reach for your chilly towel, use it in the day, and it will cool you down really rapidly and sometimes stop a hot flush in its tracks. So this is a useful resource. Jen will post up on the video where you can get
I'll put a link. This company is actually Australian based, and I believe the people that started it were linked to breast cancer. Is that correct?
Yeah, it is correct.
Yeah.
And I think they actually still donate.
Yeah.
We'll probably have to check that.
But very good resource. Yeah.
It is a great resource. And another really simple resource is there are some breathing techniques that are thought to offset hot flushes. So if you imagine a hot flush sort of starting, what tends to happen if people have them really badly, they tend to sort of start panicking and breathing more quickly. Whereas if you slow your breathing down and you just breathe in for 3 seconds, hold for a couple of seconds and breathe out slowly, that can actually offset the hot flush. So, you know, those are just little techniques that you can try and use. We'll actually post a link to some other resources which talks about these things more in depth and can add some other tips and hints. Thing is, you can do all these simple little strategies, but for some people still their hot flushes are really, really uncomfortable, but all is not lost. Now, when someone's had breast cancer, we can't, you know, generally speaking, the doctor won't prescribe you hormone replacement therapy, which sort of balances your estrogen out. And that's usually because of what we said before, that if your breast cancer is estrogen dependent, to give you a hormone replacement therapy is in fact counterintuitive. So
which is very frustrating, isn't it? Because so many women, I think, had their hormones pleasantly balanced out on beautiful HRT, but then even that option has been removed for a lot of people who have got an estrogen-fed breast cancer, which is really tough.
It is tough, but even in the general population, there are some people that wouldn't be able to take hormone replacement therapy for other reasons, maybe migraines or they've had a past history of clotting or something, but there still are other solutions. So generally, it's good to start with lifestyle type changes, which we talked about before. So drinking water, using your chilly towel, dressing in layers, avoiding wool and things like that. But if none of those things are working, there are other things you can do. So medication is another one of those. So you can talk to your doctor, your GP, or your oncologist, radiation oncologist or breast surgeon, and just explain to them how bad these hot flushes are for you. So the 3 different types of drugs they can prescribe. The one that we tend to use a lot is a medication called Effexor, and Effexor is actually an antidepressant. Its other name is venlafaxine, and there are other antidepressants that will do the same job. Now, they're not going to prescribe them to you because they think you're not coping or because they're worried you're depressed. It just, during the trials for all those drugs, they realised that the drugs were quite useful for curbing hot flushes, and there's a good success rate. You'd start on a low dose, and then if that wasn't working, you build up slightly. So that might be a useful resource for you. The other obvious thing is that because it's an antidepressant, it can actually help if you're really struggling with the diagnosis of breast cancer and actually living beyond with breast cancer. So it does serve a dual purpose, but essentially can work really effectively for reducing hot flushes. Another medication that's sometimes used is a drug called Gabbapentin, which actually is a drug they use for neuropathic pain and epilepsy. Again, when the trials were being run, I think they realised that actually this was an effective tool for hot flushes. Some of the side effects to start with the Gabbapentin might be a dry mouth or feeling slightly dizzy, but those effects wear off. The other drug that's used a lot is a drug that's used to control blood pressure. It's its name is clonidine or Catapress, and it's worth chatting through whether that is of benefit to you. The thing about all those medications is they all need to be prescribed, and they need to be prescribed in the context of what else is going on for you and what your medical history is, because it's definitely not a one-size-fits-all approach, as really is anything to do with breast cancer. But it's worth going and chatting to your doctors and see whether that's a good option for you, to see if that's helpful. Another one that I forgot to mention earlier is acupuncture. Some people find acupuncture really beneficial. The thing with doing acupuncture though is it could be costly, but then so can medications. Really.
And I'm assuming by acupuncture, Janine, you're referring to like traditional Chinese medicine acupuncture as opposed to dry needling or that sort of style.
So whether you kind of think there might be potential for dry needling there, but so acupuncture. But go to someone who specialises in this area, understands about oncology. I think that's really important, and maybe go with recommendations. The thing that I think happens though with acupuncture, it works really well while you're having the acupuncture, but sometimes when you've completed that course of acupuncture, the hot flushes can come back.
I suppose it's a nice alternative though, because what I find in the clinic is that a lot of women, completely understandably, get a little bit frustrated at being thrown another tablet to counteract the side effect of another tablet, and I think a lot of breast cancer patients or survivors also want to go as natural as possible sometimes. So the acupuncture is a nice, potentially natural alternative to a medication. But again, like you said, it's not one size fits all. Like I find some people will try acupuncture, doesn't work at all. Another person will try it, works brilliantly. So you've really got to use a bit of trial and error, I think. Is that a fair statement?
Yeah, I think so. And I think, we've gone sort of a whole gamut of things that you can do, and there are probably more that I haven't mentioned but will be in the resources that we'll provide you with. And I think you've got to work out where you sit with that. If you're having 10 or 11 hot flushes a day and you're getting no sleep at night, then medication probably is a really good option. But if they're mildly irritating or moderately irritating, you might go with doing the lifestyle remedies.
Medications as well, I think they're like a means to an end for some people, because even though it's like, oh geez, I really don't want to take another med, but it could be that it's going to impact your quality of life in such a positive way that it's actually really worthwhile going down that track, at least for a trial period, if that makes sense.
Yeah, for sure. And one of the big things I think is we don't talk about this enough, and it amazes me the number of people that say, I knew nothing about menopause, no one's talked to me. So look, as a breast care nurse, I know there are many breast care nurses out there. Talk to them. Breast care nurses are happy to talk about this stuff as well. They can guide you with some of these issues, and they can advocate for you with your oncologists and your doctors. But I also know that the doctors are really good. When you bring this topic up, they'd be more than happy to try and help you with it. interestingly, on the horizon, there is some research going on around hot flushes and the effect on women with breast cancer, and more importantly, some other, medication that's not HRT that might be way more suitable and specifically targeted for hot flushes. The medications I mentioned to you before were originally targeted for different conditions, so that's good. That's exciting
that
research.
Is very exciting,
and probably long overdue, really.
God, yes,
so.
Yes. The same with peripheral neuropathy. I find after chemotherapy, it's been a potential long-term side effect for patients going through chemotherapy, that you get peripheral neuropathy. But again, thank goodness for our Australian researchers who are now in Queensland actually looking into various treatment techniques on peripheral neuropathy. So that's a really exciting thing that's also happening. Here's a question for you though, Janine. Does exercise trigger hot flushes?
No, the opposite. And I'm so glad you said that, Jen, because I was actually thinking, dash it, I forgot to mention exercise at the beginning, so I'm hoping Jen's going to edit this really well. But in fact, exercise can improve hot flushes. This is a very old saying, but if exercise was a pill, we'd all be gobbling it up, because exercise makes a difference for sleep. So even if you do 30-40 minute good brisk walk each day, you don't have to actually go to the gym. But even if you get that sort of exercise, you're outdoors, that's good for your endorphin activity, so people generally feel better, they can sleep better, and there is some thought that it can reduce hot flushes. So rather than create them,
reduce them.
So we should all get out there.
And correct me if I'm wrong, there's also recent research that's been done on mindfulness, I'm sure, to reduce hot flushes. Is that correct?
I don't know the answer to that, but thinking about it, if you focus on mindfulness is often about relaxation and thinking about what your body's doing. So that's where that breathing that I mentioned before would probably be useful. But there are many strategies, and it's worth just having a conversation with your health professional or your friends. It's amazing. Once women all get together and actually talk, then people come up with great ideas. So if you're in a breast cancer group, try and connect with those people and see how they're managing their hot flushes.
That is such an important point that Janine's just brought up, everyone. I think one of the things that's lacking as a general resource for breast cancer patients is a direct link to your local breast cancer support group. However, there's a lot of places that don't have a local breast cancer support group. So if there's any healthcare professionals watching this video and there's no local breast cancer support group in your area, consider starting one up, because the women and the men who get breast cancer benefit from these groups so insanely well. And if you're a local breast cancer patient or survivor and you don't have a breast cancer support group in your area, consider starting one up yourself, because it's like you said, Janine, the amount of networking and swapping of information is important, but the reassurance that can come from someone else saying, oh my gosh, I get 17 hot flushes a day as well, but this is what I did about it. Just that basic information storytelling is so powerful, isn't it?
Oh, for sure. I think it's really important. Peer support is something that we're very focused on here at the Choices program, because that connection together is just so valuable. And working together, peer support and health professionals, just makes such a difference.
And the other thing you mentioned before as well is that hot flushes, I think, as a point of information, sometimes I find what's happening in the breast cancer space is that you might get a one-liner in a pamphlet that gets handed out somewhere along the way about hot flushes, whereas really you need about 4 paragraphs and someone to talk to about it. And that seems to be a little bit across the board, where it's like, I find women are often really, really keen for just that little bit more depth on the topic. It's like they will say, they get frustrated because they're like, oh geez, nobody told me about this. Whereas sometimes someone will say to them, oh no, we didn't tell you about that. There was this one-line sentence in this pamphlet that we handed out 20 years ago. So I think that's where we can improve services for patients, is that there's just some topics that as health professionals we know it's going to affect that person's quality of life so much more. And hot flushes is a really good example of that. So say if it's like, you know, something that could potentially affect someone in a big way, that's where we need to target like greater depth of information.
Yeah, and actually, to be fair, Jen, there is a really good resource through the Breast Cancer Network of Australia where that is the focus. It's on menopause, and they'll list those strategies. They direct you to the health professionals as well. It is a really good resource, and it's probably the one that I would say is well worth. It's not huge. It's just a neat little pamphlet that outlines all these simple strategies that you can use to make your life a bit better.
We'll put a link up to BCNA's website, but also specifically to the information that Janine's referring to there. Did you want to tell us about what happens at the Choices program here at the Wesley Hospital, Janine?
Yeah, so look at Choices. We are not limited to people from the Wesley Hospital. We're about all cancers, all people, so it doesn't matter what cancer somebody has. They are welcome to come to Choices regardless of where they're treated or diagnosed. A big focus for us is peer support, as I mentioned before, but we, as a cancer care nurse, I'm here to give you any information that you might need. If I don't know the answer, I can always find someone that does. We also have a counsellor, and we offer a wide variety of programs. We're quite focused on what the evidence tells us, so we have a big focus on exercise programs and wellness programs. So we run a women's wellness program that focuses on multiple topics: sleep, stress, menopause, sexuality, nutrition, exercise. So we actually do that. We're involved in research at the moment that's running that program out for younger women. We do complementary therapy, so we actually do Reiki, reflexology, Indian head massage as individual appointments, but also for patients in the ward. We have an art therapy program. We do all sorts of different things here. And actually, over the last 2 years, because it's been difficult for people to come in and out, we've managed to adapt most of our programs to provide Zoom. So if you're interested in any of those, you could just give us a call at Choices and we can connect you in. We also have different groups where we've got a group for people whose cancers come back. We've got a young women's group, those sorts of things that you may feel would be helpful. And a big thing for us is collaborating with other health professionals, which is how I know Jen, of course, and working together. And that's the thing, because if we work together for you, hopefully the outcomes are going to be better.
Yeah, we talked about the fact that, you know, when you go through breast cancer, but certainly any cancer, that you need a really comprehensive team around you, medical and allied health. So if you're not being referred on to people just beyond your surgeon or your oncologist, then definitely talk to your GP, talk to your medical team about who else can fill in the gaps of the other information, particularly on things like hot flushes, because even if your medical team don't know answers to certain questions about things like hot flushes, there's someone out there that does, and usually it does fall under this banner of allied health or other areas like that. So yeah, well, did we cover everything?
I'm not sure we covered absolutely everything, but we'll make sure the resources are there so you can see it. But thanks, Jen, for inviting me to be part of this. And feel free to call any Choices any time if you need to chat through any of that. I'm happy to do it.
Yeah, thank you so much, Janine. I really appreciate you coming on today because, as I said, hot flushes are a topic that really needs a lot more attention. So very appreciative to Janine for coming on today and talking through this topic. If you have any questions about hot flushes, guys, please leave a comment in the section below. I'll leave links to all of the things that we've referred to during this video, throughout the video, and in the description bar below. Hope you're having a great week wherever you are in the world. We'll see you next week for another video. I'm Jen McKenzie, the Breast Cancer Physio. We'll see you next time.